Today we are discussing pandemic metrics.
This is As the World Burns, tying polls, prediction markets, and forecasting into current affairs and news. I'm your host, Randall Burns.
Today we're going to be focusing on some important metrics with a US-centric focus. One of the most important metrics has been deaths associated with acute COVID-19 infection, which is a metric that is down and seems to be staying down. Now, I did a series of projections of US mortality on pandemic.metaculus.com. Here's the chart from one. What I ask you to note is that the projection has been gradually increasing. Now, hospitalization rates are down somewhat, not by nearly as much as deaths, though, and I think that is worth noting. Some of the credit here goes to improved therapeutics and mass vaccines. There's a press release from Pfizer that I included where they're looking at a very huge increase of survival after using their drugs and their vaccines. And they've been making buco bucks, like $8 billion quarterly sales as a result of this. And yes, I do think it's made a dent in the recent death count. I'm a little puzzled why it hasn't made a bigger dent in hospitalizations. But clearly the statistical link between infections and hospitalizations and infections and deaths is changing. And so this is where we're going into the fall season with. Now, a novel means of estimating infections is probably going to grow out of wastewater testing. This graph shows the cases versus the wastewater statistics. I think there's going to be some real data science needs to be applied to these wastewater statistics to get a national infection estimate. They also need a wider range of samples. Right now it's a state-by-state program, and there are a lot of states that just aren't involved yet. And the sample of collection sites per state may not be representative, so that's another problem. But I think if you apply things like employer testing data to somebody who's a well-trained data science can come up with a much better estimate and much more timely estimate of infections than we've had to date. The same site, by the way, does county-by-county estimates, and I find those actually very useful for doing things like planning shopping trips. I avoid going out when the infection rate is high in my county. Some excellent articles on how plumbers and data scientists and epidemiologists work together to make this all happen is here from the New York Times, and a couple of very, very good articles that I've linked to. And they explain both the mechanics and the theory behind this, and I think it's worth reading. The wonderful folks at In Our World in Data have a series on total excess deaths, and during the pandemic, as you can see, there's a lot more deaths than what we see directly attributed to COVID-19. And the thing is that COVID-19 deaths right now are only those that occur during the acute phase. This is an excellent article from The Lancet that tracks deaths after recovery from the acute phase. In a nutshell, it means that having acute COVID, according to the study, is roughly equivalent to taking up a 2-pack-a-day smoking habit. Now, this may well be addressed by better antiviral drugs. I think it'll have to be. Now, these figures all come together in life expectancy calculations, and those are dropping in the U.S. It should be noted that the U.S. decline in life expectancy is unusual among peer countries, and that deserves to be addressed in a separate video. Now, this is not a perfect metric, but it's one that's well understood, and it's economically important. The CDC life expectancy figures give not only the reduction due to direct COVID-19 infection, but also figures for other diseases that are contributing to this. The thing is, there are some clear statistical correlates to each of the major contributions to decline in U.S. life expectancy. For example, suicide is one of the major components to decreasing U.S. life expectancy. And it turns out there's a strong statistical link to suicide and presence of long COVID. Same thing with heart disease. It turns out the spike protein in COVID tends to cause damage that can relate to heart disease and heart attacks. And this needs to be sorted out, and it's going to take a while. Drug overdoses. It turns out that people with long COVID symptoms often get opioids prescribed by their doctor. And these are risky substances. A certain percentage of people that are prescribed these will wind up delving into addictive behavior and drug-seeking behavior. Okay, that addiction doesn't go away just because the doctor says it's time to taper off. And this may be true of other substances. Here's a link from the National Institute on Drug Abuse that delves into this also. Liver disease is also made worse by SARS-CoV-2 infection. Public opinion around coronavirus is volatile. That's just obvious by looking at the chart above. I mean, right now, at the time I'm writing this, we're in one of the more optimistic phases. Not the most optimistic phase, but in a more optimistic phase. But this is unlikely to last. Improving the wastewater testing system will give us a good idea of the number of infections in a fairly fine-grained geographic area. But we also need to be looking at sorting out what's happening with U.S. deaths. And I advocate antibody tests for all U.S. deaths. That's a fairly simple thing to do. The technology exists to differentiate between antibodies from vaccination, antibodies from infection, and we can sort out emerging strains this way and which ones are most associated after the fact with specific forms of death. If you combine this with testing, we can get an idea of how the deaths related to acute infection and deaths related to asymptomatic infections. The asymptomatic infections are especially important in young children, although there are, this is a review from Nature on long COVID symptoms in children, and that's really just now being explored. There is not a diagnostic criteria yet for long COVID, and that needs to happen. Some of these issues are brought up in this article from Fortune, and it's kind of amazing that the business press has some of the better reporting in this area. But this is a real business issue and a real economic issue, as I'll get into in a little bit. But I'm glad they did cover the issue. They do cover a lot of things like the effectiveness of RNA vaccines from a public health perspective, and that's an issue that doesn't get a lot of press, and I'm glad that they wrote this article. And they kind of needed to, because there's such a clear relationship between the coronavirus situation and investing in people's longer-term perspective. One really important metric of development is the Human Development Index, and life expectancy is a major component of that. And the U.S. does very well by GDP. It does not do well by life expectancy. It does not do as well by education. And what this all means is that the next iteration of this, the U.S. may well drop out of the list of most highly developed countries. And that has implications for things like the U.S. creditworthiness. And this is notable. This is something that needs to be paid attention to. This is going to affect this is going to affect the economic life in the U.S. and the capacity to make effective mitigations down the road in areas like investing in public space ventilation and air purification. And I think this is something that the folks at Fortune kind of know intuitively, that they have to pay attention to the big picture and not just a few players like the major airlines and the cruise ship industry. There are specific players here that are making politically motivated claims with regard to public health information. The Koch family is one. This is I have an article in the description that describes that. And I don't think a lot of folks necessarily understand all the implications of this. Thank you for joining me here today. Please hit the like button. Please make any comments that you have in the comment section. I really do appreciate them, and I read every one, and I try to respond to them. Subscribe to the channel. Thank you for joining me here. I really appreciate you being here. Have a nice day.